Thank you very much, sir. So now we'll move to question and answer. We would be using only 15 minutes for the question and answer segment. I don't know if Mr. Abdikarim, are you here? Mr. Abdikarim.
Yeah.
Okay, so you can take over for question and answer.
Okay. Thank you very much for the opportunity. Um, a very big thank you to the convener of the initiative, person of Dr. Bakari. It has been a wonderful section all along. And for me, I've learned a lot in the process, how much more the participants, who this is solely organized for.
Well, I saw one that is related to what I presented on. I think the participant was trying to ask about how to properly dispose their used sanitary, pads. And I think the person highlighted putting them in cans. I don't know what types of can, but I think the best way to do it after removal is to use, you can use the pack itself where it comes from, the original pack, fold it correctly and put it inside before you then dispose in a trash bin. Or you can get nylon, put it inside, tie it up, then you can dispose it in the trash bin. So that is the question I think I saw after my presentation. So I don't know if there are more.
Okay, I actually have a question for Dr. Amina. I don't know if I can go ahead. This question is to benefit the girls and even myself too. I just want to ask her if she can explain one or two things that we can do in order to prevent toilet disease.
Good afternoon, everyone. Ikmat, I'm still here. I've been here all along. I've been following. I've just been patiently waiting for the questions. So, there's a lot of misconception about, in quote, toilet infections. We know that, yes, everybody goes to the toilets. We have toilets in our houses. We have public toilets and all that. So a lot of people believe that there are organisms that you can actually pick from the toilet. Yes, but most of the infections that we have that people link or connote as toilet infections, they're actually things that we can prevent with good personal hygiene. For instance, I mentioned the issue of after cleaning our vulva, we should pat it dry. I mentioned that if we leave that place wet, it actually predisposes us to other organisms growing there. That is one. And then even during taking our bath, there are areas that we concentrate on because of sweat, and it's an area that's usually concealed. Our own genitalia opens to the outside, so it's open, as Dr. Bakari said. Organisms can easily get in, but the vagina actually cleans itself. So that is one. If we ensure that we pat dry, and when we are cleaning ourselves, we clean from front to back. Then the other issue is about the kind of underwear we actually use. Because the females, we know that they are, apart from the abnormal discharges that connote or signify infection, that women have normal discharges along their cycle of underwear we wear. The kind of underwear that women, girls, and ladies are supposed to wear are supposed to be 100% cotton underwear. 100% cotton, because it is cotton that will absorb those normal discharges that are coming without temperature and other things, making it go back and changing the normal temperature of the vagina. If, for instance, you wear silk underwear or underwear that is nylon, it will actually, those discharges that are coming will not be absorbed by your pants. And because of the way our reproductive organs are, between your legs, heat, especially now that it's hot, that discharge won't be absorbed and it will now go back. It will vaporize and go back into the vagina, and it will change the temperature. So the normal cleaning mechanism of the vagina will be altered, and that will make it easier for microorganisms to grow. So you can see it all boils down to hygiene. Once in a while, there might be other things that from the toilet you get those things. So those ones, they will give you other symptoms that you may actually have to see a doctor. But if you maintain this, we don't put anything inside, we clean the outside, we pat it dry, we make sure we use cotton underwear. And then when we wash our undies, we should, as much as possible, try to dry them in the sun. it will kill organisms on our underwear. So all those things will actually help in reducing that. There's another question I saw that I want to use this opportunity to answer. Asia asked, how do you clean your tongue if you have a strong gag?
How to use the charcoal and salt to clean the teeth so that you can answer both together.
Thank you very much, Mr. Olayinka. So ideally, when we brush our teeth, we're actually supposed to brush our tongue, because you will notice that at times the color of the tongue will actually tell you the health status of an individual. Yes. So if you have a strong gag reflex, you brush gradually from the front back. The gag reflex is usually activated the more you go inwards towards the back. So you do it lightly and slowly. And then if still that does not help, you can actually gargle with salt and water. It will substances down your tongue. So I hope I was able to answer your question, Ikmat and Aisha. Then for the other question, charcoal from time immemorial and salt. Charcoal has been, in fact, there are toothpaste that if you look at, charcoal is actually a constituent of it. Charcoal actually has cleaning properties and brightening properties, and not only for the teeth, even in places where we don't have access to soap. For instance, in places where there's insecurity or internally displaced people, they may not have access to soap. So that charcoal or ash, they actually even use it to wash hands. So charcoal and salt are also things that we can actually use to brush our teeth. For charcoal, you actually grind it or you beat it into a powder, use your brush and use it to brush your teeth. It's a whitening agent. It cleans it. Salt is also an antibacterial agent. So salt too, like even when we have toothache and some infections, the dentist will actually take you to gargle with warm water and salt. So they are all agents that can be used in cleaning the oral cavity and the teeth.
How can they set boundaries? If you want to know more about that mentally and emotionally.
Setting boundaries, we start with, you appreciating who you are and what you are. And you need to speak out, you need to communicate it. Prof has, giving us some healthy tips on how to communicate without being disrespectful. There are ways by which you convey your message to people without being disrespectful, and the person will respect whatever you are putting to him or her because you have said it in the most polite way. So you communicate it respectfully and you let them know that this is what you want and this is what you do not want. If you don't tell people, some people will say they don't even know. You should have told me. So you should communicate it in the best way, as we have, as Prof has, further emphasized in his own presentation, And I think I saw one other question on, can a 15-year-old use a tampon? There is no age limit to what can be used. The best way is to use it in the most how do I put it? The best way possible in terms of cleanliness, and you want to put in the hygiene, so to say. So there is no age limit. You can use the pad, you can use the cups, you can use the tampons. There is no age limit of what to be used, but an effective use of those items is what is key.
Is willing to know, can they use drug during
Yes, you can.
When they experience mental health?
Yes. If you have a pain that is getting out of hand, you cannot wait till you continue to suffer in pain, You can, but it has to be under the supervision of, an experienced or an expert, the medical practitioner, you won't just be taking drugs. They know the best drug to take for different, kind of pains that is experienced. So you will not just be taking the drugs as you want, but if you are taking it, to like alleviate the pain, it should be under the supervision of a medical professional, which is an expert that will tell you the best drug to take.
Okay.
Yeah.
Okay. In a short while from now, I would, Prof and Dr. Rosemary would also have a question to help us give an answer to. And one of the participants, two of them asked questions which are a bit similar. One is, would like to know how can she go over when she had maybe a career path, a chosen career path, or the wish of her parents, a conflict between the parents' career choice and the individual career choice? How do such participants manage that? And the second one is how to overcome a self-doubt about self personal career choice. Somebody has chosen a career choice, but at every time she felt, oh, I'm not doing the right thing for myself. I doubt if it's what I should be doing. So how can she overcome that and get her confidence to keep moving on the right path, or how how did she go about it?
Okay, thank
So
you so
doctor,
much. Yeah. Um, wow, that is a hard question dealing with parents. Uh, yeah, one has to be very um pragmatic, but also quite diplomatic in your approach to the subject. Um, I had a similar situation actually, but before I get into that, I would say talk to your parents, but beyond just talking, the steps you make, them seeing you make advances in where you decide to go to, might make them more amenable, to your decision. And over time, it will not be immediate. I mean, it's easier when you far along the line to make those changes, but when you're completely dependent, that can be a bit problematic. One thing, however, is you know being consistent in your stance and explaining to them why you're making those stance, not just because you feel like it, but giving solid reasons and consistently giving those reasons and proving yourself in other ways that you can be trusted to make decisions about things of that importance, right? Because if you're just talking and in other areas of your life, you're not really doing so much better, they'll be like, how can we trust that you can make this decision for yourself and that we're not making the best decision for you? I remember attending a graduation medical school oath taking ceremony, and this guy had finished medical school. That was back then at the University of Calabar. He finished medical school. I actually witnessed this. Actually, if it's something I read somewhere, I would be like, somebody is just over exaggerating. He finished medical school. His parents were there celebrating. He just took the certificate, handed it over to his parents. I was like, I've done what you wanted. Now I'm going to go do what I want to do with my life. And what his dreams were like event management, and he had already been doing that while in school. So he already had a base where he could start from. In my own case, my parents wanted me to study medicine, and once I got into the university, my first jam, I did not make the cutoff point, so I started with anatomy. And in my second year, I wrote jam again and actually got admission to study medicine. But at that point, I really knew that my my decision to go in that direction was mostly like, okay, we need a doctor in the family. We already have engineers. We, we have all of that. The society is like, okay, this is something you have to do. And I hate hospitals with a passion. So I was trying to imagine myself having a career where I have to be in a hospital all the time, attending to sick people, talking to, and I didn't even really like talking to people that much. So it was just a no-brainer for me to say, no, I don't want to do it. And they were, to say the least, they were highly disappointed in me. But I continued with my anatomy. I went from there straight to master's, straight to PhD. Well, when they came to the PhD graduation, they actually came. At that point, they were like, we're really proud of you. And then I had gotten a Fulbright scholarship. I did part of my research in the US. I came back. So they were already seeing different ways that, okay, this is going well, right? we can still call you doctor, right? So even though you're not a medical doctor. So I mean, that is a very dicey situation to deal with. It's just following up with patients and your own actions along the line, right? And with Usman's question, I know we doubt ourselves all the time. And you would hear people, even when they're a CEO of a company, still tell you, you know, I don't know if I deserve to, I don't know if I deserve to be here. It's a commonly known thing. It's called imposter syndrome, where even though no matter how much you've achieved, you feel like, or sometimes you feel, I can't do this. I can't, oh, maybe I'm aiming too high. Will I belong there? Or you're even in that position and you're like, am I sure I even belong here? Am I supposed to be in this boardroom with all these people? They look so much bigger than me. They look so more experienced, more knowledgeable, which is all in our heads, really. So you're not alone. That happens all the time. So like the presenter on self-confidence said, just do it. Just go ahead and do it. Do it afraid. Do it like even when you're doubting, still go ahead and do it, right? I have this mindset, and it has taken me very far. I asked myself, what's the worst that can happen? You might either get a yes or a no when you put yourself out there. It could be a no. Okay, no did not kill me. I'm still going ahead. You get a yes eventually. Sometimes you might not even get any yeses, but you push yourself to that point where you're afraid of taking the step, but you take it anyway. And I see you, or I was explaining to somebody last night that if I'm seeing something I need to get to in front of me, and what stands between me and that goal is a river. And even though I don't know how to swim, I'm going to jump in head first and try to make my way to my destination. Sometimes you might figure it out as you go. Sometimes you might get a raft that can keep you afloat as you go. You might feel like you're drowning at some point, but you get back up, right? So it's just, you doing it anyway. And believe me, you're not alone with that feeling. A lot of people, even sometimes, even personally, sometimes I feel that, when I first moved from Nigeria to teach in the US, I'm in a room full of old white men, and I'm thinking, oh my God, how can I tell these people what I actually, feel sometimes? They could be wrong. And I learned to be vocal about what I am. And then you get respected that way. So even sometimes, changing institutions, doing other things, you're trying to climb higher. And you're like, am I ready for this step? Do I deserve to be there? You do. You do. That thought might come into your head from time to time. Shake it off, right? And just keep moving. Okay?
Okay, ma. Thank you very much for your response, ma. Dr. Amina, I will want to allow you to respond to the question earlier, then I go to Dr. Bakari and Prof to also give us their response to certain questions we have.
So, okay, I don't know if you can hear me now. So what I was saying is that not everybody wants to use deodorant, but another option is, depending on how much you sweat, if there's a restroom or a toilet in your school, when you notice that you're sweating a lot, you can actually go to the restroom and wash your armpits with soap and water and pat it dry. Another option is, apart from using deodorant, you can use alum. After taking your bath and drying your armpits, you can apply alum. It also tends to reduce odor. And apart from alum, you can also use lime. You wash your armpits, pat it dry, and apply lime. So all these are to prevent the accumulation of sweat, which will now interact with bacteria and now cause the odor. So I hope I've been able to answer your question. Over.
Okay, I can see your response, but take this maybe for clarity. What should a lady who is panicked about this cessation in her menstrual period? What should
I think there is a
steps she-
cessation. There is definitely an underlying cause, and that should be investigated. I think they
Okay.
should consult a medical doctor to do a proper check to know the underlying cause, and then he'll be able to provide solution in terms of treatments and follow-up intervention.
Thank you very much for that response. Because of time, we just want to call on Prof to also, in line with the question that goes in with the career and confidence. So just to also have, if we can have his own response to the participants, then we'll go to the next item on the agenda to close this section on question and answer.
Yes.
Please, can you read out the question? I'm sorry, I'm lost. The question on career, can you just refresh my memory?
The participant asks, she has a passion she has a talent in science, and her parent is not supportive to both, but she doesn't really know what to do about navigating herself through that, and she loves doing both. Now, what can she do?
That's a tough one. Sincerely speaking, it's a tough one. But one thing I've noticed that I've seen people do things to please their parents, but there's nothing in life like self-fulfillment, like achieving your dream, getting what you actually want. So if it is talent for her, the way she put it, I want to believe that is inbred. It may not require much of effort to achieve it. This is things she will be able to do fully. Then if it is something, if it's a talent that does not require her to go to the four wall of the classroom, may God strengthen her. I don't see why she cannot combine the two. It will have become much more a problem if, for instance, if she's interested in engineering and the parent wants her to read medicine. These two require two different paths that you have to go to school for. But if it is painting, I know there are more structured way of learning painting and every other thing. But like I've explained, it's better to speak up. If you have a good relationship with your parents, sit them down. Let them know that your joy also matters. And you see what they call job, when you are passionate about something, when you're doing it, you feel like if you're not doing anything, you are happy doing it. Like I enumerated when I was delivering my. So I think first thing first is to discuss with the parents respectfully, without being confrontational, to just let them know this is her passion, this is what she calls her to purpose, this is what she would love to do, and she's happy to do. I believe at least with this age, more parents are, more amenable to open discussion with their children. So until then, I don't want to see it as a problem. If she can sit down with her parent, but if after talking to the parents and the parent insisted this is what she has to do, which as a parent, I wouldn't have done that. I'm in the medical field. My daughter, I groomed her to go to read medicine. But she came to office one day and she saw me. She would even joke, "Daddy, all you know is book. Where is the money?" She joked that she's just going to do 1 4-year course. And today she's doing a double major in financial economics and mathematics, and she's doing minor in information science. She's in the US. So I want to believe at times parents will sit down and listen to their children. So if she's able to sit down and communicate effectively with the parents, I don't see it as a problem. But if the parents insisted, unfortunately for her, if the other talents or interests is not something she needs to go to school for, I believe if God grants her the strength, she should be able to combine it. There's not a perfect answer for this question. I have to be sincere. It's not a one size fits all, but that's to the best of my knowledge. That's what I think.
Yeah, thank you very much, Prof.
Sorry, can I contribute to that from a personal point of view? Because I'm actually somebody that has talent in painting.
Would appreciate that, but we appreciate you be brief with it because we will
very brief. I'm going to be very brief. And so I have a talent in painting. I've been painting since I was in undergrad while studying anatomy in school. So, but it's something in line with what Prof said, you can do both because painting is something you love. And I still paint up till today. I still get my work out there, but I'm in academia now. So it's something you can do both ways, but you also have to think about, as much as you love doing it, what is it in the economic state that can actually bring good income and bring stability, and then you can make yourself happy along the line. Cool.
Thank you very much, mentors and darling participants. Your questions really showed you have followed through the presentations, and this is a testification that the presentation, the programs has awoken the giant in you, and we believe from now on it's going to be a new narrative.
We are done with the question and answer segment. We really want to appreciate everyone for taking out from your precious time to be here, to be part of this amazing session. We want to appreciate all our facilitators. Dr. Amina, we appreciate you. Ms. Nwaduso, we appreciate you. Associate Prof. Mary, we appreciate you. Oloyo, we appreciate you. I hear a lot about you, but I'm yet to meet you, sir. We appreciate you so much. To our participation coordination team for being able to, attract so many participants. When I saw that we were up to 44 participants, I was really amazed. We appreciate all your efforts in bringing this to life. To everyone who took our time to participate in this amazing session, we appreciate you. May God Almighty continue to bless every one of us. Thank you very much. The WhatsApp group will still be open at intervals. We'll be having a session like this. So we want to appreciate everyone for being here today. Thank you, thank you, thank you. Dr. Bakar, I don't know if you have one or two.
You said you are going to reward those who came earlier.
Yes, we are going to do that.
Yes, we have the section recorded, so we'll pick them and relay the information to the lecturer. So I want to appreciate everyone. It was not an easy deal, organizing this, even though it's a virtual event, putting hands together. Only ICMAT can be able to, say what we went through at the back end. I think it got to a time we wanted to really cut this program off, but we thank God that towards the end, a lot of people registered and we were impressed. Even though it's a free program, this is an African setting, and there's a kind of perception that is built around sensitive issues like this, especially as it relates to girls. We hope we get there someday. I want to appreciate all the mentors that have spoken their mind. I want to believe the girls too will be more appreciative, because I know they have gained, they've been well informed, adequately informed. And I hope that at the end, they will be able to use this in transforming their lives into becoming greater, leaders of tomorrow. I want to appreciate Professor Oloyo. I really appreciate your effort, your time. I know you're a very busy person. Dr.
Welcome, my sister.
I know we've been on for a long time, but I know you're also a very busy person. I thought I enhanced my camera so that the impact.
Yeah, thank you. I'm going at a hotel
how happy I am
at an event, so I had to wake up early morning.
I understand with the time difference and all that. Dr. Amina, I know you are also very engaged, but I know the kind of passion that you have when it comes to things like this. I know what you do in Zamfara State, and I know you put this to heart. Also,
thank you for having me.
My sister, I appreciate you. I know you have a lot of commitment around this time. Even despite that, you took out, out of your busy schedule. I also know what you do. We are all members, a fellow of Women in Global Health, and we know what that has transformed us into, what we have today. I want to appreciate Abdul Karim. He's always there for me, always giving me the push. He knows what I want. He knows my drive. When you have a support system just like a brother in him, I appreciate you. Hikmat Salah Yusuf. I don't know what to say to you, but I appreciate you. I love you and I love you. I want to appreciate everyone back end. I cannot mention every name. We have a lot. There's a volunteer online that just decided to join this, organization. She just wants to, create impact too. I want to believe she's also online. I appreciate you. I appreciate everyone that has been supporting from inception. It's been a long journey since 2015. Rosemary, I hope you remember. And you've always been there for me. I appreciate everyone for, rendering their hands. And I hope we get there someday. We have a destination, and I hope that God will drive us through. It is not easy, I understand, but we always, put through. The participants, I appreciate you for your time. When I saw that we got up to 40, I was like, really? We thank God. Some are on the other platform. They couldn't join because of logistics, Nigeria factor, no data, no light. But we've recorded the section. I'll be putting it on that platform for them to also, be able to gain from it, even though they've not been able to join. So we thank God Almighty for giving us this time, for making this happen. It's for a reason. And I hope that whatever it is that the participants have taken from this shall be of great impact on them. And we look forward to seeing great future female leaders. I cannot wait. I just have passion for this thing. I don't know why. So I want to appreciate everyone. Again, I don't know how to do it. I just wish I can do it more. But I appreciate everyone sincerely. Thank you very much. And God bless us all.